you are already alive in YouTube.
Thank you so much.
Thank you very much.
Yeah, thank you very much.
Thank you so much.
Thank you very much. I think we can start, Joachim.
Yes, no.
Thank you very much. Colleagues, we will start. Let me start by apologizing for the technical glitches that we experienced. We welcome the viewers and those following this discussion that we'll have on COVID-19. This is a special presentation, and it also marks a first in a series of presentations that we'll have as IFSW. I'll also start by acknowledging IFSW Global and also acknowledge Children Families International Foundation. I'll also acknowledge our presenters from Nigeria, Kenya, Morocco, Malawi, Gambia, the UK, and our special assistants in the background. We have Lola, we also have Anstance, we also have Pascal. Welcome to this presentation. Without taking much of your time, I would want to thank you for having the patience to follow us, and also the patience to endure the time lapse that we had during the technical glitches. Without taking time, let me ask Joachim to introduce himself and say a few words.
Okay, thank you so much, Noah. My name is Joachim Mumba. I'm the co-facilitator, moderator for this webinar, and I'm the regional vice president for IFSW Africa. So without much ado, I think we proceed with our first speaker. Our first speaker is coming from Nigeria. That's Onyolola. So our speaker, probably you can just say a few words, introduce yourself before you proceed into the presentation.
Okay, thank you so much. I'm Onyolola Oluwagbemiga. I'm from Nigeria. I'm a medical social worker at University College Hospital, Ibadan. And I'm one of the frontline medical social workers in the hospital and in Nigeria as a whole. I'm one of the national executive of Medical Social Work Association in Nigeria, which is also a sub-sister association of the Nigerian Association of Social Workers. Thank you.
So you can proceed, I think, with your presentation, and then when we move to the next speaker, they will need to introduce themselves and go into the presentation.
Okay, thank you so much. I'm really happy to be here. I'm grateful for this great opportunity to address the whole African region. It's a great privilege. I'm really happy. As a medical social worker, we are faced with a whole lot of challenges in Nigeria. Although in spite of all these challenges, we are still able to surmount them. In Nigeria, the federal government have closed all borders to reduce the risk of the new infection in the country, which it actually came as an unaware to us. The federal government of Nigeria, we have more than 36 states. We have 36 states, including the Federal Capital Territory. And we've banned all public gatherings, including gathering of religious organizations, to reduce the spread of the pandemic. And most civil servants have been told to stay at home, except for those that are on essential services, which includes those that work in the hospital and security agencies. And as a social worker, we're also part of the essential services, and we still go to work. As at the time of this report, as at the time of this presentation, Nigeria currently has 1,532 confirmed cases of COVID-19, and we've recorded 44 deaths as a result of the virus. And up till this evening, as I'm talking to you, up to this evening, during the time of this presentation, we've discharged 255 persons with COVID-19, and which is a whole lot of plus. And for us, we are trying to curtail the virus. And across the country, we have social workers working tirelessly, working 24 hours. And as a result of this pandemic, we have to shift our work roles. Normally, we work between 8 a.m. to about 4 p.m., or probably we run shift. Some will work at night, some will work in the afternoon. However, when the virus came in, we have to shift everything. We have to reduce the number of people that comes to work to about 3 or 4. And then when we do that, we have to increase the number of hours we work. So we have to work extra hours, like about 24 hours per day. So like I had to work 24 hours so that we could actually have more time and to work. And as a medical social worker, we fall into the category of essential worker, which I've said earlier on. Social workers is part of the frontline workers. And then during the Ebola virus, federal government of Nigeria actually appreciated the role of social worker because we assisted the federal government in ensuring that the virus didn't spread by doing contact tracing, ensuring that everybody comply with the Nigerian Center for Disease Control guidelines and then the WHO guidelines. And then we ensure that everybody has appropriate education. We conducted a whole lot of social mobilization in order to ensure that everybody is safe and sound during the Ebola crisis. However, when COVID-19 came, it came to Nigerian government as no surprise because they know that this would affect a whole lot of things. It's going to affect economic structure of the country, to affect the vulnerables, the marginalized, and then they felt it's very important for them to incorporate social work as part of the task force of the federal government of Nigeria. We have the presidential task force. Unfortunately, we don't have social workers as part of the presidential task force. But in each state of the region, because they know we have a whole lot of social workers working at the grassroots, we have social workers being part of the being part of the task force. And one of the specific role we do is the fact that we ensure that every person that comes into the state, that comes into maybe our health facility as a social worker, they comply with our guideline of prevention, and which is very core to us. And when you comply with the guideline of prevention, then it reduces the spread. One other roles we do is that we do contact tracing of individuals that have had contact with the index patient. What do I mean by index patient? Those that have been confirmed positive of COVID-19. So what we do is that we get the address, the travel history, where have we been coming from. And when we do that, we do contact tracing to the residents of those they've had contact with. It's a whole lot of work for social worker handling this because Nigeria has a complex housing system. Complex housing system in the sense that most of the houses are not well numbered. And when houses are not well numbered, it will be very difficult, extremely very difficult for social workers to navigate this, to navigate and ensure that those that have had contact with the index patients are seen, educated, and instructed to self-isolate or probably taken to the hospital if they are symptomatic. If they are asymptomatic, we advise them to stay at home. They should not go out, and then we give them a guideline. The family members and then the patient himself or herself will follow in order to reduce the spread, both within the family and also the community. We provide psychological first aid to the patient, especially some of us that work in the isolation center. I work in the isolation center over last about 3 days ago as a social worker at the emergency department. We provide psychological first aid to a patient that has been confirmed positive. And when we provide psychological first aid, we allay their fears. We allay their anxiety. And then a whole lot of them has to mostly develop a whole lot of concerns about the infection, like leaving the hospital. Will I be stigmatized? Will I have problem with my job? Will I have problem with staying alone in one room without any means of interaction with my family members? So we allay that fear at the point of entry. And the fact that when they are there, we have problem with funding and all those things. But we as social workers, we have to ensure that those services they need while they are there are provided, because we serve as the next of kin until relations comes around. We are just, I've said that earlier on, adjusting time schedule, and also we serve as one of the members of the phone-in program. For the past 3 months now, we've been having cases of domestic violence and gender-based violence. We have a whole lot of our colleagues that work, especially those that work at the community level, addressing gender-based violence and domestic violence at the community level, because we have cases of, as a result of lockdown, as a result of staying together for long hours, a lot of families are becoming scattered as a result of that. But we, as social workers, we receive phone calls to address this issue of domestic violence. And in order to address them, we call the family members, call them on phone, meet them places, place, and then organize family meeting in order to ensure that this doesn't escalate and also cause further social problem in the community and also in the family. We also participate in the enrollment process of poorest poors of the citizen. The new Federal Ministry of Humanitarian Affairs of the federal government of Nigeria established a national register for the poorest poor. Who does this? We social workers does that. We have, we are one of the team that, we were part of the team that developed the social protection guidelines for the country in order to, like a yardstick to measure the poorest poor in the society in Nigeria. And while doing that, we enroll them per household. We are not doing it maybe per community. That will be activated very soon, actually. But it's currently that's the plan we have in the guideline, that household per household, we enroll those that are identified as the poorest poor, and then we ensure that they are given palliatives during the COVID-19. Currently, there are some states that have been receiving palliative, but some states have not, like those that reside in the southwest region of Nigeria. Like, I reside in southwest region of Nigeria, which is Ibadan. And those that reside in Lagos are being provided palliative by maybe a senator in a local, in a senatorial district, or probably some government officials provide palliatives. But it's not directly from the federal government of Nigeria to the citizen. It's not direct service like that. So what we do now is that as social workers, we identify those that are in need. There are some that are provided, that receive daily income even while at home. They are still receiving their salaries. They still get job being done, and then they are living fine even during the COVID. But the fact is that as citizens, you are entitled to some basic needs. But for the poorest poor, we know that they are most at risk, and then they are vulnerable. We ensure that services are provided to them. I mean, palliative services in this regard. And we don't work alone as social worker. We work together. We work in collaboration with community development associations. We have landlord and landladies associations in Nigeria. And this group of people assist us in contact tracing, ensuring that we communicate effectively with community members, family members, especially when it becomes a lot of crisis in them. They actually assist us when the messages are being passed to them. They might not understand it better as they might not understand it when we give it to them. But when the community leader, like the chairperson of an association, delivers the message, it sinks into them, and then they digest it and accept it as a strong instruction from them. And then they take ownership of it and ensure that their community is prevented from COVID-19. It's very important to also identify that we engage in social mobilization by ensuring that we disseminate the right information to the community, because we understand that when this enters, it attacks the community, it attacks a whole lot of people, it attacks the vulnerable, it attacks older persons, it attacks children, it attacks anybody. So this virus doesn't know age, it doesn't know any kind of social status. So we understand this fact, and then we go on radio stations, we go on television stations to disseminate information about the virus and then ways of preventing the virus spreading.
Thank you very much, Olu. I can see that in Nigeria there is a lot of work that is happening. We will come back to you with a series of follow-up questions, and for clarity, we also urge those who are following to note their questions and send them using the various platforms. We'll come back to you. Thank you very much. With that, we'll move on to Morocco and ask Ismail to present what they are doing up north and how they are interacting and also responding as social workers. Ismail.
Okay, hello everybody.
Hello, how are you?
I'm fine, thanks you. I'm waiting and so tired, and but no, I'm so happy to participate with you in this live stream. And first, I'm going to present myself. I'm Ismail Lafdil. I have 33 years old and married, waiting for my first daughter next month. And I'm a founding member of the Moroccan Association of Social Workers, responsible in the international relationship of the association. And professionally, I'm a social worker in the Agency of Development and Rehabilitation of the Old Medina of Fes. So in my presentation, I'm going to tackle 3 main points in this presentation concerning this updates of the coronavirus in the world, and I'm going to tackle the subject in Morocco and how social workers do help in containing this coronavirus. So the 3 main points that I'm going to tackle here in my intervention is the strategy of the Kingdom of Morocco to contain infection. The second point is the role of social workers in facing coronavirus. The third, I'm going to propose some suggestions to create cooperation between Morocco and various countries from Africa and different countries. So the first point is the strategy of the Kingdom of Morocco to contain infections. So which since the beginning of this epidemic in our country, His Majesty King Mohammed VI gave instructions to urgent measures to prevent the spread of this virus. The measures are started by stop flights and the sea. And as you know, Morocco, which exists in this tragic place, and the virus, as you know, starts from China to Europe and to America. So because we are so close to Europe and we have many of our families and friends in Europe, they come from Europe to Morocco from time to time. So they spread this virus to Morocco. So the first measure or instruction that we do in Morocco is to stop flights and sea in order to limit the arrival of visitors infected with the virus. The second measure is the restriction on movements for citizens in order to not help the virus to spread better more. So we in Morocco exit is allowed only for absolutely necessary. They give us a certificate in order to go out to work or to purchase food. I'm going to show you some of the certificates. We have 2 in Morocco. This is one given by the authority in order for a person to go out to purchase food and go medicine. And the second certificate is given us by our administration in order to go to work. So without this certificate, you cannot go out in this period. This is one of the measures. The third measure is to stop public transportation and close mosques and also cancel all the 22 events and organizations of sporting, cultural activity, and so on. So for the purpose of reducing cluster. The fourth measure is suspend all education and activities nationwide to keep students and pupils safe and encourage also in this in regard of this suspend of education is encourage distance learning. So many students now have the ability to study by online. We also, the government compulsory mask for everybody to go out. So the mask is available to everybody here in Morocco and in very cheap price to help citizens to go out with not affected by this virus. And also, we don't forget to spend also the majority of private sectors and private societies. So in general, many societies and administrations work in very small times. So this kind of measures, we do it in Morocco by other measures, it's a financial measure in order to, as you know, to stop work. It is so difficult and impacts economically and social on citizens. So the Moroccan Kingdom creates special fund in this reason, which cover all the economic and social problems that can happen in the period of coronavirus, including providing financial compensation for job losses and the poor people. There are till now more than 2 million persons benefit from this fund. And from this fund, we can distribute food aid to vulnerable groups and migrants, including brothers from many African countries who are sitting here in Morocco. The strengthening of infrastructures of equipping of hospitals by the construction of the largest Africa hospital in city of Casablanca, which include more than 700 beds in 2 weeks. So these are more instruction and measures that do in this period. And I'm going to tackle the second point of the role of social workers in facing Corona in this period. Of course, we are in the Moroccan Association of Social Workers from the beginning. We have worked to mobilize all social workers and psychological support service providers by creating distance communication platforms to provide guidance and psychological support to citizens. As you know, the impacts of this coronavirus on psychology and psychology. So communicated with various international organizations working in the field of social work to exchange experience and develop our knowledge. And this meeting is one of the given example. And we have also another one with some friends from Canada, and we are going the next month to go doing a webinar about the importance of social workers and the role of them in this period of coronavirus. And you are welcome to be alive with us in this mainstream. On the other hand, the Ministry of Social Development work on carrying for groups of individuals without shelter by providing medical care and nutrition to 5,000 persons, as well as provide support to children in social centers and abused women. In this respect, social workers do important roles who work in this ministry in following up and giving social and psychological support to those vulnerable people. Social workers in the health sector do at this period a big role, and it is a big role for social workers who work in the health. We find them along with doctors and nurses where everybody work for the benefits of society. So these are must work that social workers do in this period. And we, in our association, we do ourselves in helping to help people to transpass this coronavirus situation. The third point here, draw this virus and its economic, social, and psychological effects and challenges to enhance cooperation between Morocco and various countries. To face challenges of this kind, we propose the following propositions. I propose, and with discussion of with our friend in the association, to strengthen South-South cooperation in the field of international cooperation in the social field. Supporting schools and invite you to support in school and university to encourage distance learning. Enhancing communication and exchange of experience between organizations and societies of social work in our continent, Africa, to face the challenges of poverty, development, water scarcity, and wars. Advocacy to develop training, increase the number of social workers among all Africa countries. We invite you to enhance communication and coordination with the Moroccan Association of Social Workers and to engage in future projects and programs in its plan for the South of South. There is a special program of Morocco and the countries of Southeast Africa, and you are welcome in this project if you wanted to share with us your experience and in the field of social work. Finally, the Kingdom of Morocco will continue to be a land of all people, and you are our brother. So welcome you to visit Morocco and learn more about the progress that the kingdom now in this era of the king of our King Mohammed VI. I just wanted to mention that to give you the number of the coronavirus death in Morocco now is 169. The number of the recovered now is reached to 1,000, and the total case is 4,300. So these strategies and this instruction give its a big impact for contain and stop the infection of this coronavirus. And I wish all African countries to be safe and healthy and to transpass this virus.
Thank you so much, Ishmael. Thank you for that story from Morocco. That are quite inspiring. So now we are moving to Kenya. We have Alice Mbiu. Alice, can you please introduce yourself? I think we want to learn more also from Kenya what social workers do in the work of coronavirus, and also the challenges that the social workers are facing as they are, supporting the government in fighting COVID-19. So Alice, is all yours.
Hello all, thank you Joachim for the opportunity. And this is a very good platform. My name is Alice Mbiu from Kenya. I represent the Kenya National Association of Social Workers. I'm also a representative of the, as the vice chair, the current sitting vice chair. I'm also a representative of the IFSW East African region. And as you know, COVID-19 is one of the few or the big pandemic we're facing today. And I don't really want to discuss much on other disasters that we are facing, but they're emerging and they're really strong and they're not helping very much in fighting the virus too. We have the rainy season, which is causing a lot of floods, and a lot of people are getting displaced. We also have the swarms of the locust, which has become a very big menace, and it's really I would say degrading the environment in terms of feeding on everything. So we are hoping that the government can do something in that regard. But as we're here, we are discussing about the COVID-19. My discussion will be in two parts. I would say a bit on what the government has done, and also I will relate what the government has done with the relationship of how social workers are coming in, because we work hand in hand with the government, and we cannot overlook the impact of the government just to work as an individual entity. Social workers are also in government, so their impact is being felt both in government and both in in government and also as the association and social workers in general, because we have other elements of social workers like the medical social workers, we have the educators. Yeah. So I would like to start with what the government has done to try and put under control the COVID-19. We have a dusk to dawn lockdown, which this is the second phase. The first phase was introduced 21 days ago, where the government gave a lockdown within the metropolitan cities and 3 or 4 other cities which have a rampant infection of the local transmission of the COVID-19. And the lockdown means that we have areas that are jurisdicted and you can't just pass unless you're given, probably you're like what Olu said, you're a service provider in the front line, and that is where social workers come in. Like the medical practitioners, of course, they have IDs and everything else, but also the people affected within those areas have tags or small car stickers just to identify from the area you're coming from. And probably like where I'm standing, it's like around 300 meters or 400 meters to the border of where we have the barricade, and it's being manned by the the GSU, or the administration police. And it is really a strict border where you cannot cross just because you need to go somewhere. So you have to be in lockdown and you have to give a very good reason. We had an issue of the border being totally locked down, where even medical practitioners were not allowed to pass without a valid reason, but that was resorted out by the government. So the government is taking very serious precautions on that. We also have the mandatory mask wearing. You cannot go outside, or no one, actually no service provider can serve you without a mask. It is also mandatory to have either sanitizers or washing water with a bit of soap. That encourages probably just the disinfection of and you're not allowed to touch services. You're also encouraged to make sure that you give the space between 1 meter or 1.5 meters apart in terms of any place that is they're delivering services. So the government the numbers right now, we have 368 confirmed cases of COVID, and we have 129 recoveries. We also have 15 deaths. So the Kenyan government is doing a lot in terms of containing the virus. We also have quarantine centers where, in case there is someone who had traveled, or someone who is found within an area of symptomatic or even asymptomatic, you're being encouraged to go through the, they're not very encouraging, like going through the quarantine centers, but you're also being encouraged a lot to self-quarantine for you to ensure that even if you contract the disease, at least the 14 days self-quarantine or isolation will give you a good idea, or will bring out the results. We also have a it's called mass testing, where targeted mass testing, where they're testing people who are within a certain area of high risk infection. So the government is doing a lot on that. I'd like to jump onto the side of the social workers. Last year, around November, we had the Young Carers Program Festival, which was very successful. And the Kenya National Association of Social Work, in conjunction with COSWA, that is a Commonwealth Association of Social Workers, and the UN and other interested partners, came together and followed up on the young carers who were part of the group that was presented, and the young carers. And they contributed some amount, and some face mask and some sanitizer and some food donations. And they reached out to the families. We have some pictures going around the social media of how effective the impact was felt, because we reached over 100 family members or family individuals, who included older persons, orphans, and also we had several people living with disability. So there was a lot of impact being felt, apart from now the usual people of goodwill coming together to ensure that their neighbors are well taken care of. The social workers in their areas of jurisdiction also have come in big ways in terms of sensitization and giving masks, and also doing social support in terms of ensuring that we have people understand the impact or the implication of the COVID-19 stigma that is coming up. We had an issue that a social worker was dealing with, where you see like a family had one of their family member being put under quarantine, and when they came out negative, the community around there was stigmatizing them and saying they're not very sure they are safe, they're going to infect them with the virus. And I mean, it creates a big stigma, and it has a ripple effect where even they could not even go to the local market or get attended in the area. So that is where the social workers are coming in. And we had two of the social workers going into the system, I mean, into the community, and trying to explain to people why, what are the myths of the COVID-19 and how they can be able to tackle, or how they can be able to address the stigma that is coming with it. We also had the young carers who are probably not in very, I would call them conducive, maybe household situations. And the social workers during that time, when they were trying to reach out, you also try and give psychosocial support and link them also to the local administrator or administration, where they can be able to be given an opportunity. Just a minute. They can be able to be given an opportunity to also benefit from the social protection flows of the government through the mapping system. So I don't know what else I've left out, I've missed out, but Joaquin, is my time out?
Thank you very much, Alice. Thank you very much, Alice. We'll come back to you with follow-up questions that will lead us to get more information with what is happening. Joachim, are we learning more from what is happening in Africa?
Yes, we are, I think, learning quite a lot. And for us, really, this is going to be a point of reference in the future. And we are going to document all this, and hoping that it's going to inform how we do our social work in Africa.
From the presentation that Olu gave, one of the issues that came out is the issue of social workers being in the front line. Maybe a question that would come to mind is the question of personal protection, that social workers, are they given this protection? One would want to ask. From the presentation from Morocco, one would also want to ask, I had Ishmael talking about the support that social workers are giving in the area of education and the use of online education. How feasible is this in an African context, in your view? And maybe would also want to raise that question. Another issue that came up is that the issue of floods and other natural disasters that Alice was talking about, and how does this then compound the problem of COVID-19 and the situation that people have. Do you have any comments on the presentation so far, Joachim?
So far, so good. And when you're talking about the challenges, for instance, the issue of floods amidst COVID-19, and we are talking about the floods in Kenya, but then also our colleagues in the DRC were facing the challenge of floods. So I think it makes the problem more complicated. When it comes to the issue of PPE for social workers, I mean, like here in Zambia, we're having a challenge to have them for medical workers. So it becomes a problem really to extend the support for prevention for social workers. But I think we'll get to that, and I hope the presenters will be able to react at the end on some of these issues being raised.
Who is our next speaker, Joachim?
So, moving to the warm heart of Africa, I believe that is what it is. We have Stefano from Malawi. So Stefano, please, if you could just come through and say a little bit about yourself and share experiences in terms of social work interventions in Malawi in the wake of COVID-19.
Thank you very much. My name is Stefano Joseph. I am the district social welfare officer for Blantyre, that's a district in Malawi. I'm a very passionate social worker, and also I'm an interim secretary of the Association of Social Workers in Malawi. We have a young association in Malawi that is working to bring social workers together in that regard. Now, coming to the response of government and social workers in regard to COVID, Malawi experienced the late onset of the COVID-19. A state of disaster was declared by the president. That was on 20th March, which among other things stipulated measures such as actually ban on all public gatherings, closure of schools, ban on international flights and cross-border passenger buses, and so many others. In terms of what we have experienced so far, we have had 36 confirmed positive cases of COVID-19. We have had, sadly, 3 deaths as well as 7 recoveries. Now, the big challenge for Malawi has been, while all the measures that have been taken by government have been in the good effect to protect the public, but there have been also a lot of issues in terms of the concern of the people, in terms of the survival and so many other things because of the poverty levels that are very high. Coming to the role of social workers, there have been a lot of issues that have been done from the medical aspect and also coming to the social workers. Our association in Malawi had issued a statement that actually talked about how social workers are supposed to be guided and discharge their duties in the midst of the pandemic. But further to that, there have been a lot of efforts that have been done by social workers, some of which include the following, because of I'll talk about the provision of mental health and psychosocial support. We have already mapped the various service points in the country to look at how best we can offer mental health and psychosocial support because we anticipate a lot of things that will actually come to the fray because of the issues of GBV, issues of discrimination, as other speakers have already alluded to. There have been also a lot of dissemination of factual information in as far as the pandemic is concerned. There have been a lot of misinformation in the communities in as far as the COVID-19 is concerned. Others are still wondering whether this is real or not. This is also attributed to the low literacy levels in the community. So social workers have been involved a lot in those actually dissemination of factual information that we hope to guide the communities really absorb and really understand that this is real. But apart from that, social workers and even paraprofessionals are also involved in the various service points that are actually discharging the duties. Like I would give an example of the community victim support units, where the child protection workers, the police victim support, the one-stop centers, the helplines, as well as the child justice course, ensuring that these things, COVID-19 issues and information is really addressed. But one other critical aspect that the social workers have been involved in are issues to do with the children. In Malawi, we also have children that are playing in the streets because of issues of poverty and so many. And we have been involved in ensuring that those children are really withdrawn from the streets through adequate sensitizations, so that actually we know that one of the key things that our government has really advocating is an issue to do with social distancing and so many things. But when the children are there looking for arms, then they must come closer to the people that are going to seek the arms. So these are the issues that also we are trying to sensitize the public, and also the ministry that is responsible has been very supportive. Further to that, we have children also that are in institutions or the CCIs, we call them child care institutions. We have been also looking at the issues of how best can we reintegrate those children, because we know where the public schools are closed and so many other things. And we believe that even children in those institutions also, if they are still in those institutions, issues of social distancing, the issues that we are talking about, they have been a very big issue. So we have been actually raising awareness, ensuring that those children are assessed and also are integrated back in the community. We are also happy that yesterday the president really addressed the nation, and in form of the update on what government is doing to mitigate the effects of the coronavirus, because there have been a lot of talk to say, yes, we are talking about these issues, the social distancing, the issues of maybe restricted movements and what have you. But what about the issues of those that are too vulnerable? Yes, we have other interventions that social workers are doing, issues of like cash transfers, which are especially the unconditional ones and as well as the conditional ones. But also there have been issues of now the cash transfer that are going to target the urban poor. And mostly these are the areas of the social workers that are going to work in those areas to ensure that issues of the vulnerable are well taken care of. But also we are talking about issues of carrying out case management issues to ensure that maybe we develop proper plans for each of the people that are involved in the issues. Now, there are also some other proposals that maybe social workers in Malawi would want to see maybe happening in the country as well as maybe the entire. The first key thing is that we are aware that the president has constituted, at first it was the Ministerial Task Force on Coronavirus, and yesterday during the address, it has been restructured to include other people and the various stakeholders. I would like as social workers to see also maybe a social worker included, because now we have seen the chiefs being included, the religious leaders also being included, and now we would like also to see the association itself, maybe the president and so many other, maybe a few individuals included, because we know that apart from the medical aspect of this COVID-19, but as Alice has alluded to, the major impacts of this virus also has been the issues of stigma, discrimination, lack of knowledge, misinformation, and distorted information. So we believe also social workers will play that crucial role to ensure that we sensitize the masses. But also we are also doing, and we're also continuing with increased awareness to ensure that maybe the communities continue to get the right information, and there's so many other issues that they will need to do. In terms of the challenges, some of the other challenges, I think people have alluded to the PPE, which is also a challenge, as Joachim has already alluded to. It's a challenge even to the medical and even to the social workers. I remember when we were carrying out the awareness in the streets, we had, of course, to ask from the medical guys to say, please, we need this and that. So in a nutshell, Malawi is doing quite a lot to ensure that maybe we bring information, the right information. And maybe one thing that I didn't, I just wanted to emphasize on the mental health and psychosocial support. We have ensured that we have mapped out the referral pathways to ensure that people get the necessary help and they are referred, get the right information when needed. Thank you very much.
Thank you very much, Stefano, for the presentation from Malawi. I see the global Secretary General is also following this discussion, and he has a statement that he has issued. Joachim, can you share the statement and the sentiments of the Secretary General?
Yeah, so the Secretary General was communicating with us through Skype, and he's basically sending a message to African social workers. And he says that we know social workers in the African region have an immense challenge. On top of the lack of state resources, you now have the added extreme stresses of the virus and its economic consequences. IFSW at the regional and global level stands with you and will continue to do so. Together, we are learning from one another, sharing our knowledge and strengthening the social work response. IFSW globally wants to thank and acknowledge all social workers in the African region. Your approach of building community capacity to fight this virus is saving many millions of lives. So basically, this is the message coming from IFSW Secretary General. Thank you so much, Rory, for the support.
Thank you for that. We now move on to our next speaker, who is Anna Marie from Gambia. Welcome. Hello. Maybe Joachim, if we have lost her, we could try to move on to Godfred, then come back to her later. Godfred,
Okay,
are you?
Yes,
we can proceed with Godfred.
Yes, we can.
Hi, Joachim. Hi, Noel. Can you hear me?
Yes, we can. Hello, how are you?
I'm very, very well. A very warm good evening to all our colleagues in Africa and also all our colleagues from around the world joining us for this really important webinar. My name is Dr. Godfrey Barhen. I work for the British Association of Social Workers. My portfolio at the British Association of Social Workers includes working on international social work, working on social work research aimed at improving practice, and also the use of digital technology in social work practice. I have recently published a paper for Oxford University Press on thematic issues in social work in Africa. And I am here this evening really to pull together some of the excellent themes from the excellent presentations by my colleagues from around Africa, which have really highlighted what social workers are doing in their respective countries. What I want to do is put these together and then identify some lessons for social work, for the social work profession now, and as we move on further to fight this virus. And I want to do this by drawing on some of the lessons from the UK. The first lesson that I want to highlight from the UK is the need for social workers and also policymakers to think about both the health and social care sector in the policies that they implement around COVID. So according to the website Statistica, as of 29th of April, the UK had recorded 21,678 deaths. And today on the radio, it was announced that there had been 26,000 deaths in the UK. And so there are predictions that the mortality rate in the UK is on course to be the highest in Europe. So really the UK has important lessons to share with the world around this because of the relatively high prevalence rates of COVID and also the high mortality rate. But when we look closer at how the UK government decided to approach the work on COVID, the focus was predominantly on the health system. And when policymakers spoke about health, they really were focusing on the role of hospitals. And we are now in the UK starting to understand perhaps the mistakes of the predominant focus on hospitals, because the death rate for older people living in care homes is increasing at an alarming rate. So it would seem that the disproportionate focus on hospitals has been at the detriment of services in the community. So one lesson from this that I want to share with my colleagues in Africa and around the globe is that we also need to focus holistically on this, on both health and social care, strengthening communities and also skilling up our communities to deal with this emergency. And some of our colleagues from Africa have already explained the excellent work that social workers are doing in mobilizing the community to do this work. A second lesson that I want to share with colleagues from around the world, drawing on the UK experience, is that the data from the UK suggests that COVID tends to have a disproportionate impact on minorities. And what do I mean by this? The UK has a large minority population. So the 13% of the UK population was born outside the UK. 3% of the population of England and Wales is of African origin. And most of this population also tend to live in the urban areas. So the issues around them replicates some of the experiences that may occur in the highly densely populated regions of the large cities in Africa. So now let's consider this data in terms of the impact of COVID on minorities in the population. So for instance, the Financial Times reported yesterday that in Norway, people born in Somalia have infection rates more than 10 times above the national average. In the United Kingdom, despite minorities being only 13% of the population, they have constituted 18% of the deaths in hospitals. And another statistic which is worth reflecting on and holding on to is that in the UK, 70% of professionals who have died from COVID have been from minority backgrounds. And there have been several explanations for this in the debates in the UK. Some have said that minority populations have higher incidence of comorbidity, they live in more densely populated areas, and therefore the rate of infection was likely to be higher there, or that they have health inequalities anyway. But this evening, I want to pose a question to my colleague social workers around the globe. The question I want to pose is, what if these statistics and this data actually show that COVID is having a fundamental impact and is throwing into sharp focus profound ethical issues that social workers have to grapple with? And some of the ethical issues that COVID is highlighting is questions around, are some people deserving of scarce resources than others? Are some lives worth protecting more than others? Where there are scarce resources, should some people have those resources as opposed to others? And lastly, what is the most ethical way of distributing resources in an emergency? So these are profound ethical issues that I noticed that colleagues in their presentations haven't highlighted or explored. And I want to say that this is an important point for us to focus on. The last point that I want to highlight is also the need for us to think in a really creative way around partnership working and also new agencies that we can link in with for support around COVID. An example that I want to use here is the Commonwealth, which has traditionally not been given the same status as a generous donor as other supranational organizations such as the UN, the EU, or USAID, for instance. What we do know, though, is that the Commonwealth has a partnership strategy aimed at forging closer links between civil society organizations in the Commonwealth countries. So that would, the Commonwealth, for some of us from African countries with historical ties to the UK, the Commonwealth might be a really important source of support for social care workers and social workers in our work against COVID. And I'll urge all our colleagues to refer to the website of the Commonwealth. So I just want to use this to highlight the need for us to think creatively around the work we do, strengthen our multi-agency work, strengthen our partnership arrangements, and involve civil society. Lastly, I want to conclude by showing that actually in this period of social distancing, we as social workers can draw on digital technology to really do some important work. We are, after all speaking on Zoom today and sharing our knowledge of our experiences of social work in our respective countries on Zoom. So digital technology might be a really good way of us to continue some of the creative work that we've already started doing. And I acknowledge some of the technological issues in some African countries, but I think we need to think about its role in this fight against COVID. So just in conclusion, I just want to, well, really compliment my colleagues and also thank them for the creative work that they are doing. And COVID, we're all experiencing COVID differently in our respective countries, but at the same time, there's some common experiences. So there's a need for us to continue sharing our experiences and learning from each other. Thank you very much.
Thank you very much, Godfred, for that perspective and sharing those experiences and also insights into what is happening and possibilities of what we can do as social workers and also the use of technology in our work. Thank you very much for sharing. Joachim, do we now have Anna-Marie with us online?
Yes, we have Anne-Marie, and maybe before we move to Anne-Marie, just a reflection on the presentation from Malawi. I love the interventions around children living in childcare facilities and also children living on the streets. And I think these are usually the lost boys, see how really they can be supported in the midst of COVID-19. So we can move to Anne-Marie from the Gambia.
Anne-Marie, are you with us? I think we are still experiencing technical problems. We will be working on it. Maybe we could also reflect on the presentation. You were talking about what social workers in Malawi are doing and their work with children on the streets, those who are living and working on the streets. It is interesting that in most African countries, you find that social workers are also in the front line.
Okay, so I think we've lost Noel. We can move. Anne-Marie, are you there?
Yeah, I'm here.
Okay, so please, yes, please. So please just give us a brief introduction of yourself, and then
Right.
you move to sharing your experiences from the Gambia.
Okay. First of all, I want to say a big thank you to you all. My name is Anne-Marie Hughes, currently serving as the Vice President for the Association of Social Workers in the Gambia. I'm also working with OPI as a trauma response team officer. So back to the Gambia. The Gambia, as most of you have known, is the smiling coast of West Africa. It is one of the smallest as well as the poorest country within the Africa. The Gambia has never experienced anything like this before, and in such a way that it has to shock many of us. The roles of as social workers in the Gambia here, we are playing great roles, but our roles are limited. The social work
Okay, it seems we've lost Anne-Marie. Okay.
Hello, Joachim.
Okay, yeah. So Anne-Marie was on the floor. Anne-Marie was on the floor, but seems we've lost her.
Okay. Can we move on to Anstance to share with us insights while we work out the technical problems?
Sure.
Anstance. Hello, Joachim.
Yeah, Lola is trying to unmute Anstance. Let me just. Okay.
Hi, can you hear
Hello,
me?
Anstance. Yes, we can.
Hi,
Thank
everybody.
you.
Thanks very much for having me. And my name is Anstance Fometu, and I'm the chair for a small charity in the UK called Children and Families International Foundation. And our main aim really is to support social work practice. And our main project is social work, supporting social work in Malawi. Obviously, COVID-19 has affected all of us worldwide. And my current experience is that I'm in lockdown here in the UK. So I'm homeschooling my kids and everybody's in the house. My husband does go out, and we do go out for exercise. We do go out for shopping and just do the essential things. And one of the observations we've done, obviously my family is still dotted around the world. We've noted some of the use of the word lockdown in a lot of African countries appears to be very punitive in a way, whereas how it's being used here is a little bit different, and there's a soft lockdown. People can still go and do their shopping and come back, and you know, you can do your exercise and come back. And if you need to go and see the doctors, you can still do all those issues. So we are on lockdown, but things are still, you know, we have access to a lot of services. The issues of poverty are affecting all of us in different ways, and people are being unemployed because of lack of work, especially those that are employed, self-employed, or those that work on contracts. In some of the stories that we're hearing in Africa, we're seeing that social workers are doing the best they can, and social workers in the UK as well have the same barriers. We have concerns about domestic violence here. We still have concerns about domestic violence in Africa. We have concern about girl children that are mostly highly abused when they are in confined spaces. I think most of the social workers, like some of the speakers have said, are dealing with some of those issues and sensitizing families to protect the children that are in lockdown. Mental health is an issue. And again, a lot of fear that is being generated by misinformation that has been talked about by most of the other speakers. What I would like to really emphasize on is that there is good practice that is coming out of Africa, and a lot of communal community approach that is very holistic in addressing the issues of COVID-19 are coming across. In the West, if you want, in the global South, we are very individualistic, whereas in Africa, we're seeing a lot of community interventions that are protecting communities. And at grassroots levels, we have different layers. We have counselors, volunteers, and because of the HIV/AIDS issues that we've had over the years, we are seeing a lot of counseling that is going on and peer counseling that is being utilized from the reports that we are getting. So there's a lot of scope to learn from Africa, and I think there's a lot of scope to harness those lessons as practitioners, because we can see that it's working. We'll look at it at the end, but we know that those links we have in the communities, the chiefs, I think Stefano talked about the chiefs are part of the process. Those are the people that are embedded in the communities. So we're seeing that. We would like to see churches, because a lot of African society is also knitted into churches, into mosques. We would like to see those leaders take up some of those safety nets for psychosocial support. Yes, it's spiritual support, but we've got to get the message right that we are all in this together, and using those ties in the communities. We are seeing more and more. Yes, we have poverty is a big issue, and some of our health systems are weakened, but we can take this chance to reflect on strengthening our social protection systems and social workforce, because we from what we've heard, there's a lot of good practice happening and good reflections.
Thank you very much, Anstance, for your reflections and your comments. You are appreciated. Joachim, do we have our speaker from Gambia, Anna Marie?
No, it seems we've lost her, so we may just need to proceed.
We do apologize for that. We have been facing some technical challenges, but we hope this will improve. We apologize also to the panelists that she had to endure the technical challenges. But I think from the presentations, you do find that there's a lot that is happening in Africa, Joachim.
Yes, there is a lot that is happening in Africa, and I think it's incumbent upon us Africans to tell our stories. We need to start telling our stories, and that, for me, I feel this is the first step. And it is the first step in the right direction. We will be proceeding with a number of sessions, I think, in the weeks coming, and we'll have different speakers from different countries within Africa. So we want to learn from one another, and we want to learn in terms of what is happening in the region.
So before we end this session, can we go back to our speakers, starting with Olu, and just giving him 2 minutes to try and then wrap up the presentation and what came out from the other presentations. Then we go around the presenters before we conclude. Is Olu with us?
Yes, I'm here.
Yes,
okay.
Seb.
Yeah, thank you so much. I'm really happy. Let me first of all answer the question you asked me. Are social workers given personal protective equipment? First of all, we are given personal protective equipment, but it is not enough. Not that we are not given, it is not enough. However, we keep giving a whole lot of messages to social workers, medical social workers at the front line, that ensure you have face mask, ensure that you wash your hand. Once you see a patient, use hand sanitizer, and you use glove. And maintain social distancing. Ensure that when you see a patient, make sure that you use your face mask. Make sure that you use your PPE equipment. It is not enough, but we have them. We have them, and we are using them. So, well, it's a great opportunity. I really want to commend the International Federation of Social Workers African Region for this opportunity. It's really awesome. A whole lot of our colleagues from Nigeria are saying thank you, Mr. Olu Jacobs, Mr. Moshood, Alhaji Moshood, every one of us here in Nigeria, they are saying thank you so much. It's really in fact, I'm a young social worker, but for them to have said that, we are proud of you for the fact that you'll be representing Nigeria. And then I'm one of the national executive of medical social work. I'm the current general secretary of the association. So I'll put up a report, submit it to my association. We might come up with a policy brief. I will share it with the whole house, and we'll get back to you. Thank you so much. COVID-19 will come and it will go. The most important thing for us is to keep safe, keep sane, and then we ensure that we are protecting ourselves and our family. Thank you.
Thank you very much, Olu. Let's move on to Ishmael. Maybe let's Anna Marie is with us. Maybe we could come back to Anna Marie. I'm sorry to the other presenters. Can I come back to Anna Marie for your presentation?
Yeah, sorry about that.
Yes, you can proceed.
Okay. As I said earlier on, social work has been in existence in the Gambia for over 13 years, but the work of social workers are limited in the Gambia here. So in the fight against the COVID-19, we have some of our social workers that are in the front line, working hand in hand with some of the health workers. We have social workers that are providing psychosocial support to victims of COVID-19, although the cases in the Gambia are small compared to other African countries. Presently here in the Gambia, we only have 11 cases, and out of the 11, we only have 2 active cases, unlike other countries. And then we have, for now, the country has registered only 1 death. So the work of social workers in the Gambia are not too effective like other countries within Africa. We only provide few services that are limited within our boundaries. For instance, we have social workers that are working as psychosocial, that are providing psychosocial support to those in the quarantine centers, as well as their family members. We have social workers that are working in communities, in different communities within the countries. We provide awareness to the people in different languages, because Gambia is Gambia is known to be an English-speaking country, but majority of our people speak local languages. So that is where the work of social worker comes in, wherein as we go to the community and raise awareness on COVID-19 in our local languages. But because of the limited resources that are available to social workers in the Gambia here, we find it very difficult for us to implement our work. Because one thing for sure is that social workers are not recognized in the Gambia here. That's a true fact, that's a fact of it. We have government institutions that are not putting social workers on board. And in this fight, I think one of the most important things that government should have done was to put social workers at the front line. But if you see the amount of the number of social workers on the front line are limited, simply because many people do not know the worth of social workers. And we as an organization, as well as an association, we are trying our level best in providing services for our community. The community where I am living in, we are providing psychosocial support. But even with that, it's through phone calls, because we are not provided with protective gears, which of course, it will be very risky for us to go to the field without protecting ourselves. So that is one of the problems that we are facing in the Gambia here. And in time of follow-ups, social workers are on the front line, tracing contacts, especially with those that are already having the virus. So, but though, as I said earlier on, the cases are limited in the Gambia. For now, the country have only tested close to 471 tests that the country have already tested, which of course it's limited. It's too small compared to other African countries. And that is only done when you have the symptoms or you feel ill and then you go to the hospital. That is the time that you are tested. So that alone has a big gap because we do not know the accurate cases that we are having in the Gambia. And then in the Gambia here, the role of social workers is it's more about protection, to protect our people, because for now we are right now in temporal lockdown because the government have is it like a month ago announced 21 days temporal lockdown. Schools are being closed, universities has been closed. We have even the workforce. Many people are not going in and out of the country, which is affecting our people because Gambia is one of the poorest countries in West Africa. So social workers want to come on board to help them. But because of the limited resources, we feel so tied up to do that. But so good for now because the president just announced 2 days ago that he is going to provide foodstuffs for the people, especially the vulnerable group in our community. We have children, we have mothers, we have whole people in our community that need support. Because if we take their livelihood from them, then what are we providing for them?
Thank you very much, Anna Marie, for that insight from the Gambia. We wish you well. But just another question that has just been posed here are the guidelines like social distancing working in the Gambia?
To an extent, they are not working in the Gambia.
Why is that so?
I think the restriction is not too serious because yes, the government have put some measures. It's just like you can't put measures of be locked down in the house when you can't provide for your people. The government is not doing much in providing for us. People are in the Gambia here, as I said, majority of our people live below $1 a day. So if those people can't put food on their table, how do you expect them to sit in their houses? So obviously they have to go out and look for somewhere to have something for themselves. So that's the case.
Oh, thank you very much for that insight. Do you have any other last words that you would want to say as we move through the panel for last comments?
Yeah, one of the last thing I have to say is that the social work in the Gambia, it's not too active, to be sincere. Let me be sincere. So all I want is that the government have to play a role to appreciate and also to know that social workers are people that play key roles towards the development of a country. Because when you have a social worker on the field, then they will help to minimize the impact of any situation that wants to arise. So that's the only thing I have to say for now.
Thank you very much. Joachim.
Yes, Noel.
Interesting insights from the Gambia to say how then do you distance, then do you institute these guidelines when you're hungry, when you don't have the provisions? It does then affect compliance.
Yeah, I mean, that is very, very critical. I mean, we saw some videos on social media. I think in Malawi, it was the same. I think the government was about to announce lockdown, and then people went out in the streets demonstrating because the issue was that if we go under lockdown, we're not moving, we're not doing business, then what are we going to eat? How are we going to provide for our children in terms of food? So I think those are some of the issues that we need to start looking at, and also governments to start considering.
Let us move on now to Alice to give us her comments and concluding comments.
Hello, can you all hear me?
Yes, Alice.
Yeah.
Lovely. So there was a question that was posed in regards to what the social workers are doing as we fight COVID-19 in regards also to other disasters that are coming up. what I can say is that the association or the social workers are, we have 8 regions within the country, and all of them have a established social work branches that we can be able to liaise, and every area is unique with its own pandemic intensity, I would say, or disaster intensity, because in some areas the COVID itself has not yet emerged, or they don't have any registered cases. But for example, they have the swarm of the locusts, which are destroying food crops in the communities. So in areas like that, the social workers, they are trying to liaise with the local administration so that they can be able to be part and parcel of sorry, to be part and parcel of the administration, and also be able to help in terms of they're giving it a word where I don't know, I can't remember the word very well, but it's like trying to kill or trying to minimize the impact of the locust and what they're doing in terms of disaster. And the medicine, is it the medicine or the pesticides they are giving in terms of how to fight the locust, and what is also the impact, and also for trying to understand that the communities are not supposed to be consuming the already infected or killed locusts, so that they don't have a backlash in terms of the strong pesticides they're using on the locusts.
Okay.
That is just one. Let me just give a few more. I also want to say in the flood disaster areas, they're trying to help. They're also part of the response, the security response system, where they are helping in the restoration, and also trying to put back people back in their livelihoods, where they're trying at least to be part of the administration, or even just social workers, the branches, to try as much as possible to bring people together and tell them, even if disasters have struck, how can we be able to help through psychosocial support, restoration of small enterprise business through the small funding of the partnership they're getting with other organizations, that they can be able to redo or revive their livelihoods. When we come back to the pandemic itself, for the areas that are hit, the social workers are trying to also work online or bring up small skits that show or indicate how to probably use the masks well, how to dispose them, what to do, how to lobby for, or how to identify people who are in dire need and how to link them up with. So it's just a network that we're trying, or we use to try as much as possible to create as much as positive impact, because now the internet or social sharing or ideas are online. So we try to use both social platforms and technological platforms.
Thank you very much, Alice, for the insights and also sharing what is happening in Kenya. Thank you very much for that. We will move now to Ismail in Morocco for your concluding remarks.
Okay, no, it seems Ishmael is gone.
He's gone.
So we may be wrapping up.
We move on to Stefano.
Yes, please.
Yes, thank you very much. Let me echo first what Godfrey really echoed on the issue of maybe what UK did by focusing more on maybe the health aspect, neglecting a bit of the role of social workers. I think this is also another very good learning point, that we need countries, especially in Africa, to focus more on the role of social workers in the fight against COVID-19. Because what we need to do is a lot of things that are happening, for example, issues of poverty, resistance, and so many things. There are issues that are happening in the community. So we need to focus more on the role of social workers in addressing the issues. Governments have to make sure that social workers are really involved in this critical fight against COVID-19. Further to that, let me just echo on the situation of Malawi to say, like in Malawi, we have a vibrant social work body, which is really working at mobilizing social workers and ensuring that social workers indeed play a rightful and meaningful role in the national in national issues and the issues that affect the population at large. So we are really very happy because we are learning also from the global, from the region, and so many other people. Joachim and Noel are not new people to Malawi. They have been here to help us set up our association, and indeed we have we are really working, we are really standing, we are really able to do a lot of things. In terms of the association in Malawi, we are currently registering members, and yes, we are seeing some members really coming in to register. And we believe that with the steps that we are taking in Malawi, social work in Malawi will one day be a learning ground for most of the countries in Africa. So thank you very much for this opportunity, and we look forward to many social workers from Malawi participating in a forum like this one to show that indeed in Malawi there's social work working.
Before you go, Stefano,
yes,
what are the responses in Malawi that you are using as social workers in terms of engaging communities that are working? Are they things that are working?
Yes, in terms of the communities, the things that are working are the issues of, like I have said, we have been to the communities to raise awareness on the various issues. And because social work in Malawi, we have what we call the paraprofessionals, we are the child protection workers that are working at community level, and we have social workers at district level as well as at national level. But also we have social workers that are in practicing in the various organizations. Within the organizations as well as within the government, we have been together going to the various organizations to look at those things. At district levels, we have seen actually having what we call the protection clusters that have been meeting to set the agenda. For example, like in the district where I'm serving, we were able to look at what are the various stakeholders doing, what are they doing, where and how. So we have tried to capture those things, consolidate, and look at what are the things that are being done, what are the gaps that are there, and if we are to do more, what else do we need to do more?
Thank you very much, Stefano, for sharing your thoughts and having time to be with us. We wish you well and wish social workers in Malawi well.
Thank you very much, Noel.
Thank you very much. Godfred, are you still with us?
I am, Noel. I am.
Just a parting word, quickly.
Yes, thank you so much, Noel. I have 3 really quick points. One is, and again, I'm speaking from the UK perspective here. The first one I want to highlight is that really Africa has strengths in community social work. And I think we need to really focus on how we can utilize that great model of social work at this critical time. What we are finding in the UK is that there are increasing calls for us to rethink our models of practice, putting community social work at the center, because in this era of social distancing and where the access to formal services were reduced, people were drawing on community networks to support each other at this point. The second point I want to highlight is we should not forget as social workers that we have a role in speaking truth to power. We have a role in questioning taking for granted knowledge. I say this because the science around COVID is so uncertain. And sometimes there's a tendency to present this uncertain science as a truism, that we all have to follow. Actually, we've learned that policymakers have a range of choices at their disposal, and therefore they can't retreat behind science as objective truth, as if it's an invisible hand of science directing them to take one course of action over the other. They do have choices in this, as we've heard from examples in Malawi and Gambia. Actually, if you choose to do social distancing in Africa, well, you can't say it's science alone. People need support in order to buy food and also sustain their livelihoods at home. The third point and the final point that I want to say is that because the science is uncertain and new evidence around COVID is being uncovered all the time, we need to keep on top of our training and continuous professional development. And whilst in some resource challenged countries, this would be difficult, you know, there are organizations in the global north that provide free access to all this information. My own organization, BASWA, for instance, has a whole section on COVID. And whilst the guidance and the evidence is based on the UK context, I would argue that it's really applicable throughout the world. So there's free, we need to think of how we can access free learning and training resources from reputable organizations in the global north.
Thank you very much, Godfred, for that insight. The Anstance is with us. Your concluding remarks.
Hi, am I on?
Yes, you are.
Yes,
okay. I think we've heard from different speakers, and I think I'm really encouraged with this conversation, IFSW and all the colleagues that are here. I would like to encourage a lot of social workers to participate. We've got a website, IFSW COVID-19 Africa Response, and IFSW is also running a lot, the hashtag response that we need to get in touch with. The next week we'll be talking about ethics and human rights, and it's going to be an interesting one, and I would like to encourage you to send questions. If we again, you know, have these technical issues, just be encouraged that we will be covering a lot, and ethical dilemmas that social workers are facing in the field, ethical dilemmas that are brought about because of the organizations we work with, and human rights issues. I think we need to have that robust conversation and see how we move Africa on. And one thing is for sure, that we are seeing government trying, we are seeing social workers out there putting themselves out there to do the work that they have to do. But the most important thing is that we are there to protect vulnerable and vulnerable children and adults, but also question some of the methodologies that are being used to oppress the already vulnerable people. And social workers, we have the training to be able to objectively speak on behalf of the oppressed, and also our practice. We know that we always do, you know, anti-oppressive practice, anti-discriminatory practice. Those are the values of social work, and we need to put them in place and question governments that are oppressing their own people. And, you know, I'll end on this. We all know the Maslow hierarchy of needs, and the bottom line is physiological need, food. So we cannot move to safety unless people have eaten. And we all say this in Africa: a hungry lion is an angry lion. So we know that people will be affected in terms of their mental health if they don't have basic physiological needs, and that's food and good shelter. So I'm glad to see that street children are being housed. There are people who have mental health problems who roam around streets of Africa from southeast everywhere. We see these people. Social workers, let's watch out for those people, but speak for them. And again, I'll end on this. We all know the Maslow's hierarchy of need. The bottom line is physiological needs. and people have got to be fed.
We gotta eat. Thank you very much, Anstance. Joachim, your comments as we wrap up.
Okay, so thank you so much, Noel. I think maybe just to amplify what Anstance has talked about in terms of our next conversation, we are going to be focusing on ethical dilemmas and human rights in the wake of COVID-19, and we'll be looking around from across Africa for speakers. And so those that are following and listening in, if you want to be part of the panel, please, you can reach out to us, and we want to learn more from our practitioners in the field. We want to learn more from social workers that are in the front line. So Noel, I think I just want to say thank you so much to the speakers that we've had, very, very brilliant speakers. And also want to say thank you to Lola and Pascal, who've been in the background providing support. So
we
thank
also
you so much.
Extend our thank you. We also extend our thank you to IFSW Global for making this a possibility. We extend our thank you also to our partners who also helped us in making this. Also to mention Children and Families International Foundation as well, that came through to help us and work with us. You have also mentioned Lola and Pascal in the background. We do apologize for the technical glitches. We hope we will improve with time. Also to say to social workers in Africa, you can share your videos with Global. Send these to Lola, Pascal, or the Secretary General direct of the good work that you're doing. Also participate in the ongoing, there's a survey that is going on, Joachim, on the challenges that social workers are facing and other issues. So social workers can also participate in Africa on these issues.
Yes, they got to participate. And also tomorrow there is another webinar organized by Global IFSW. So we encourage you to be part of the webinar.
And what is the hashtag and the buzzword, Joachim? It's hashtag
social work response. So that's the hashtag.
Thank you very much to our panelists and also to the presenters. Joachim, thank you very much. We look forward to next week. Thank you very much. Thank you, Lola. Thank you, Pascal. Bye-bye.
Bye-bye.
Thank you.